In just a month, our adult hospitals have seen their COVID hospitalizations jump almost 5 times higher, creating real stress and challenging their ability to maintain some services. Sadly, in addition, more Ohio children are now landing in the hospital due to an unexpected summer surge of respiratory illnesses. And with COVID-19 on the rise, we may be approaching a perilous situation. At this time, the Ohio Children's Hospital Association has reported that they are seeing a wave of respiratory viruses and illnesses typically seen in winter rather than summer, namely rhinovirus, parainfluenza virus, and respiratory syncytial virus, better known as RSV, all on top of COVID-19. Rhinoviruses are the leading cause of the common cold, and they can trigger asthma attacks and have been linked to sinus and ear infections. Parainfluenza virus, not to be confused with the flu, causes upper and lower respiratory illnesses, particularly in infants and young children, older adults, and people with weakened immune systems. It can also cause croup, bronchitis, bronchiolitis, and pneumonia. Finally, there's RSV. In older children and adults, RSV mostly causes mild cold-like symptoms. But in very young children with smaller airways, such as toddlers and babies, RSV can be far more serious, causing trouble breathing, pneumonia, and bronchiolitis. RSV infections typically occur in late fall, winter, and early spring. This unseasonably early increase in RSV, coupled with rising pediatric cases of COVID-19, is a recipe for disaster. Although, thankfully, our children's hospitals are not yet at critical capacity levels, we're very concerned. Emergency departments, ICUs, and hospitalization rates are at levels more comparable to what we experience in the winter. It's not winter, it's August, summer, and therefore it's likely that the worst is ahead of us. On top of this wave of winter pediatric respiratory viruses, based on the pattern seen elsewhere, we can expect further increases in COVID-19 case rates driven by the highly contagious, dangerous Delta variant. And it's not really an issue of children being at risk for COVID or one of these respiratory illnesses. In fact, it's not uncommon for children to come down with 2 respiratory illnesses at once. Nationally, there have already been reports of children simultaneously developing RSV and COVID-19. And while not enough is yet known about the impact of having both viruses together and whether having COVID could worsen the course of RSV, I firmly believe that most parents of young children don't want to find that out and would prefer to take preventive measures to protect their children. So as we're sending children back to the classroom and into extracurricular activities, we have to be cognizant of how we can keep our children safe and healthy. The very best way to prevent COVID-19 is vaccination. Vaccination is simply the best way to protect eligible youth from getting COVID-19. And for younger children not currently eligible for the vaccine, the adults and teens around them can substantially insulate them by choosing to be vaccinated. Thankfully, we continue to see eligible Ohioans choosing vaccination, and we're coming very close to 60% of those 12 and older having started their vaccines. Another way to protect children, of course, is with masks. Last year, we saw remarkably low numbers of other respiratory illnesses, including RSV and influenza. And as you'll recall, we were all wearing masks. As we've discussed before, mask wearing significantly reduces the risk of spreading respiratory viruses from one person to the next. When you're infected with COVID-19, many times unknowingly, you can pass the virus to someone else simply by talking. That's because COVID-19 spreads from person to person by way of respiratory droplets released when an infected person sneezes, coughs, or talks. When worn properly, The mask blocks your respiratory droplets from reaching another person. And it isn't just COVID-19. Other respiratory illnesses are spread by droplets as well. We saw the impact of masking this last year when masks helped limit the spread of COVID-19, along with other respiratory illnesses. There were simply far fewer cases of respiratory viruses like flu, RSV, and colds. But when the masks came off, people started getting sick again. Now, as we see these abnormally high numbers of summer RSV cases among children, just as we're encountering a tremendous Delta wave of COVID-19, we continue to urge caution. But there are steps we can all take today. First, choose to be vaccinated from COVID-19. This flu season, get your flu shot. Wear a mask. Wash your hands. Practice social distancing. Do it to protect yourselves, to protect the children around you, and to protect the babies too young to protect themselves, who are vulnerable to severe cases of RSV.